Good evening, all. My name is Dr. Khan from South Africa, Cape Town. This is a follow up video recording of the coronavirus and it's an update. As you are aware, we are way over 8.5 million of people that's been affected globally. And the country which has the highest number is the United States, over 2.5 million, which is fairly high, followed by Brazil, 1.1 million, followed by Russia, which is about 600,000, followed by India, 480,000. You have the UK, over 300,000. You have Spain, about 300,000 as well. Peru, about 264. And then come to South Africa, just close to 112,000 affected cases of the coronavirus. What has transpired, as you notice, that the virus recovery rate is almost 50% in most countries, fairly most countries. And we've noticed that the remote areas like islands and smaller areas, their numbers are much lower. We know the virus pretty well now. It's virulent, meaning spreads fast, spreads like mad, like crazy. It's not like a normal flu virus. It's much more spreading. Having said that, everyone has been affected, from the elderly to the middle age, to the teenager, and to the young. And across the board, all have been admitted to hospital for various conditions. And as we know, that the elderly are mainly affected, and mainly over 60 years of age, we are at high risk. Yes, we are aware are those patients who are overweight, obese, those who suffer with hypertension, diabetes, asthma, lung conditions, whether it's sarcoidosis, lupus, whether it's something called pleurisy, whether it's something called TB, HIV, those patients with anemias, high blood, low irons and high iron levels, and other immune conditions which are prevalent in our society. In South Africa, we have a unique case that the diabetes is very high, as it's very high throughout the world. Next to cardiovascular diseases, meaning heart conditions, diabetes is fairly high. But of note, the diabetes is almost becoming the number one illness of the world, followed by the other cardio conditions, very close to one another. But what we've also found is that the patients with various forms of cancer, because of poor immune system and poor defense, their numbers have come close to the diabetics and the hypertensive, somewhere around there. So once again, it's a scary virus. Much has talked about vaccines that's available. That was America was trying to create, as well as Italy and various other countries. They spoken about dexamethasone, which is now available in a form of injectable, which are preferably used in hospital setting by our specialists and our colleagues with reservation. This medication has been used many years ago for patients with edema, meaning swelling to the brain, and various surgical conditions to reduce pressure in the brain, and obviously for lung conditions as well, but predominantly up there. We do not use it in our practice daily, it's not advised, not recommended, only supervised by a specialist or people trained in the field. We have the anti-flu vaccine strain, which has been available, the 4th strain vaccine, which helps those who have lung conditions, immune compromise, those with TB, HIV, and the like. It could be used. Many patients are resorting to other forms of therapy, which are your herbal options, which I encourage them to use. There's no harm in using herbal medication, whether it's local herbs, whether it's acquired from Himalayan product, whether it's acquired from Zimbabwean product. These are all herbs, may be used readily. However, we do also have medicated items which you could acquire from your chemist, pharmacist, which is recommended your zinc tablets, up to 50 milligrams daily, your vitamin C, 1,000 milligrams daily, your magnesium daily, your vitamin D, either 10,000 units per day or 50,000 units weekly. You may add on if you do not have any anemias or iron abnormalities or severe hypertension. You might use your iron supplements as well. Those moms who are pregnant, you can still continue the pregnancy as normal. Do not fear much of transmission from the mother to the child. The child has good protection via the immune system. At this stage, normal birth can take place. There is no data showing that kids who are exposed to unborn kids who are pregnant in mom's belly, and those moms who are pregnant, there's no data to show they're at high risk at all. And these various tests were done by gynecologists and professors in the field. So we could be relaxing and calming, we could be relaxed about the whole scenario. However, moms may take precaution, as you know, wearing your gloves, sanitize frequently, wearing your mask, wearing your snoots, wearing your PCAPs, wearing whatever gear, your hand gloves throughout. Wear it, sanitize frequently. I've been doing that and I've been safe for now. I do consult many patients, and I would advise my colleagues that do not consult patients if you do know they have severe flu symptoms. Rather do it telephonically, do it virtual, do it online service for now. If you have to and you have no choice, please do wear your PPE clothing, which is your personal protection, with the full cover of the head, the body, the legs, the hands, gloves, mask and your shield. That will protect you much more. Do use foggers. These are things to sterilize the air. Ventilate your place as much as possible. It is winter in South Africa, so it's difficult to ventilate, but do as much as you can. At home, even moms, please ventilate your rooms in your houses. Allow the air to circulate. Those who need to undergo quarantine, I'm sure by now you know what it means. Quarantine means stay away, hide away in your own little room, like I mentioned before. Stay away from the family. If you're infected, if you got the virus, there's an incubation period which starts up to about 5 to 6 days of incubation, and that can extend for 2 weeks. We have found many patients still having the viral load climbing here by 6th, 7th, 8th day, preferably. That's when you do the testing. The viral load is best checked at that day 8 I would say, to see viral load, meaning the higher level of virus in the system, using a blood called viral load. Obviously, it's expensive to do all these tests, so we go by observation. Isolate means remain in your own room, be served through a tray. Family helps to assist you. Try and do not use the same areas which they commute, or the areas where you live in, or the areas where you wash or shower. It's difficult in South African scenario, but you can avoid it better. For those who are concerned about when do I go back to work, if you have been exposed to the virus or in contact with anyone with the virus, as most of my specialists are recommending, have said, if you were 1 meter in proximity of the next person, that's high risk, simple as that. Quarantine for 14 days, stay at home. If you are tested by day 8 and you're negative, you should be fine by the 14th day. If you are tested by day 8 and you're positive, stay at home. Add 14 days to that. From the day you tested, add 14 days. However, your 14 days actually starts from the day you're exposed to the person, but you don't know until you do the test. Many of the colleagues are in ICU, in hospitals, they're at home, they're ill, and as you know, we're all battling with this disease and illness, and all our colleagues are finding it tough. So, caution measure for them is go into an area, come out from the area quick as possible. Try not to go to malls, try not to do bus trips, try not to do taxi trips, try not to do 4 or 5 members in the car, not allowed. I would suggest driver and the passenger in the back. I wouldn't even recommend passenger on the left, passenger in the back. Rather create more distance for one another, that's better. The patients are asking, doctor, can you reinfect? Of course you can reinfect. There's no data to prove that you can't reinfect. There are data proving that people have reinfected. Way back, tests were proven they were reinfected. It might not be the alarming rate. Your immune system protects you up to 90%. I would say in the last 10%, you might not have that full cover. So try and eat healthy, exercise in your area or wherever you can. For those athletes who are excited to go back to cycling, to gym, to run, to jog, big warning, of concern, of note. Many of my patients who are physically fit to the age of 40 have gone back to cycling, had the virus day 1, June the 1st, recovered 14 days later, asked me, can they go gym? I asked them, do they have symptoms? You tired, fatigue? They said no. On day 16, 17, they went to cycle. And boom, the following day, he was back in hospital. So you have severe chest pain, shortness of breath, and you got a panic attack. So clearly there's inflammation process taking place which brings you down. Once again, wait 1 solid month. If you're able to stay at home solid month. Do not gym and exercise in this period. Exercise bare minimal. Stationary bicycle, that's fine. Do not cycle outside. Try not to run outside either. You know, there's a big issue about, do we inhale the virus while running? Is that possible? And obviously recommended that we run with these masks, which has the little window period here and this side here as well. The more you have of these, the better to run. However, it becomes tough and difficult. Otherwise, run with a shield. You'll be vaporizing here, if that's okay for you. If you're running on your own, there's nobody around, you don't need a mask. It doesn't make sense. Because this fairly, you're inhaling carbon dioxide all the while, and then become dizzy and lightheaded. So what are the symptoms of the virus? Symptoms are tiredness, fatigue, nausea, vomiting, headache. Many of my patients are complaining only of dizziness. Many have backaches, fever, bizarre pains, bizarre feeling, doctor, I can't breathe, I feel like dying. Those are in dire need to see a doctor. Should we test everyone? If you're frontliner like myself, nursing staff, policemen, teachers, emergency care, we have the preference of to be tested, followed by the other people. However, we also have preferential for those who are affected by the virus, meaning the elderly, the diabetics, the hypertensive, the lung problems, the asthmatics, the hypertensive, the overweights. They also have preferential treatment, should be treated first. The issue is, should we go to school? Should we not go to school? If your immune system is fine, good and solid, and you're not at high risk, you can go to school. Likewise with kids, it's been shown the percentage is less, close to 2% of them getting infected. So kids can go to school. However, those who have immune compromise, or parents who are ill at home, or families who are ill, stay home if you can afford it. If a child must lose a year at school, too bad, let them use the year. If you can afford to restart education next year, by all means. Unfortunately, we do not have a clear-cut rule, what is right and what's wrong. Should we go to church? Should we go to mosque? The more you're in contact with people, the more you're going to get the virus. Never mind how fit and how strong your immune system is, you can get that virus. That virus is coming for you. It's so sad that many of our patients out there do not use protection. They do not use the mask. They do not use gloves. They do not use beanies. They do not use caps. They do not have PPE clothing. You will end up in ICU. Is it better to have a mask and struggling to breathe? Yes. Than lying in a hospital on a ventilator? Pipe in here, pipes out here, tubes all over the show? I would prefer this. Can't breathe and run with this than running to ICU. So you want to run away from ICU. Don't go to the intensive care unit. Don't go there. Many of patients think it's a joke. I'll get patients say, doctor, this is a whole man-made created thing. I don't believe in it. Wait till it affects you or your family, and then you take notice of what's happening. People are saying, doctor, but how do you ascertain when is a curve getting worse, flattened, or better? We go by reference, looking at the examples overseas, how the curve took place, how the numbers increased. That's how we acquired. We didn't know it before what the virus was going to do in any case. So the trend is going upwards. Should we be scared and go to lockdown 5? The answer is yes. Take every precaution in the world to improve your situation. Don't worry about the next person, worry about yourself. You are important. If you use protection, if you cover yourself, if you eat healthy, if you gym minimal, and you sleep well, and have a good mind, and you do some yoga, and do some breathing techniques, and use all your herbs, and drink a lot of liquids, especially warm liquids we recommend. If you can't take aspirin to thin your blood, by all means lemon. Simple as that. So, word of caution, stay at home, stay with your family, do not go out. They ask me, doctor, but how come you don't get sick? I spray in and out my house, my hands, my doors. I go crazy. My secretary is washing the money. So I sound like a laundry mat we are running. So what? Rather bizarre things we do than regret being in ICU and say, oh, I didn't wash my hands. Oh, I didn't wash my car handle. Take precaution. Be safe. Take care. I hope this will encourage you to be more cautious now than ever before. We have family. We have leaders. Listen to the people, the doctors, the professionals. Please take note. Obey the law. Wear your mask. Reduce or stop smoking where you can. Reduce or stop alcohol completely, please. People are getting ill. History proves it. That over and above, if you are conscious what you do and caring, you're better in the long run. I hope you're well and take care. Thank you.